Hello again, ladies and gentlemen. Cranial nerve number 11, accessory nerve, or more correctly, the spinal accessory nerve, exits the brain from the medulla oblongata, and it's motor only. Innervates the shoulders, the upper innervates the trapezius muscle, and we assess the upper fibers, as well as innervating the sternocleidomastoid muscles. Now, with the upper traps, it's going to enable shrugging action, so this, and then with the sternocleidomastoid, it's going to enable contralateral rotation at the cervical spine, so turning your neck to look over one shoulder, and it's a contralateral one, remember. So, as ever, introduce yourself to the patient and confirm patient details as well as gain consent. Hello there, I am Zahir Abbas and I'm your osteopath for the day. I'm here to assess one of the nerves. Is that okay with you?
Yeah, that's perfect.
Lovely, and that's that. So, Abdurrahman, what I'm going to do here is I'm going to ask you to shrug your shoulders as well as look over your shoulders. Do you have any pain?
I do.
No, you don't.
I don't.
Do you have any pain at all?
I don't.
Anyway, wonderful. So he's fit and well, otherwise there's no issues. I've made sure he's not in any pain. So, Abdurrahman, if you are in pain at any part of this, do let me know. If any discomfort, please do let me know. We'll go from there. Is that okay?
Yeah,
Wonderful. So, Abdurrahman, can I just ask you to shrug your shoulders for me, please, sir? Wonderful. Nice and high. Give me a nice big... Okay, wonderful. Thank you. And just look over one shoulder when you're ready. And straight ahead again. And over the other side again for me, please. And straight ahead. So here we're looking at any asymmetry in the rising of the shoulders, as well as when Abdurrahman looked over the shoulders. I'm looking, one of the ways to determine how much motion you've got is to see how much exposure you've got of the side of the face as they turn. For example, if he's not turning his head enough, then you won't get as much of a view of the side of his face. And that's one of the ways to go about it. Or otherwise you can kind of measure how much of the hairline you can see after the ear and various other markings. Once you've done that bit, then you're going to actually do the resisted muscle. So typically I'd stand behind the patient, but due to restrictions I'm going to do it from here. So I'm going to do the same thing. I'm going to place my hands on your shoulders, and then I'm going to ask you to shrug against me, and I'm going to push down. Is that okay?
Yeah.
Are you in any pain around the shoulders, otherwise in pain or tenderness?
I'm not, no.
Wonderful, lovely. So I've gained consent to place my hands on, and shrug your shoulders for me, please. Wonderful, lovely, and that's raised nicely. Thank you very much, and relax. Lovely. I'm now going to place my hands around your face. Is that okay? Lovely, and just look over one shoulder for me, please, and straight ahead, and look over the other shoulder, and straight ahead. Lovely, thank you very much.
No.
So the reason I place the hands around the face is, again, just to secure the neck and ensure that I'm getting a very controlled motion without causing any unnecessary pain or discomfort or otherwise around the actual face. And that concludes the examination. Abdurrahman, that's everything. Thank you very much for your time. Do you have any questions for me?
I don't know.
Wonderful, thank you.
you
Don't
very
forget, as ever, to wash your hands before and after the examination. Thank you.